Oh, I'm working in Chittagong Medical College as Associate Professor of Pediatrics. It's in Chittagong, Bangladesh, port city of Bangladesh.
I'm Professor Hussain, working now in Apollo Hospital, Dhaka, in the Department of Pediatrics and Child Health.
Do you think your patients understand that everyone is at risk of dengue, regardless of age, sex or socio-economic class?
Yeah, actually, before 90s, dengue was unknown in our country. But in early 90s, there was a huge outbreak in Bangladesh. After that, every rainy season it comes, outbreaks occur. So everybody knows about dengue. Everyone is aware of dengue in Bangladesh.
And in fact, if I say, back in year 2000, there was, devastating effects of dengue. A lot of doctors even died from dengue. At that time, actually, even our doctors didn't know how to manage the basic problem. But now we have got many, many more cases, and the cases are being diagnosed early, and mortality is almost nil nowadays. But there are many, many cases of dengue now. But considering their experience, dengue is a really alarming, disease in Bangladesh. Yeah, people are very scared about it. If they know that the child might have dengue, they come for admission, close to observation. That's very important.
So one thing is to be mentioned here that dengue fatality decreases, but still it is prevalent in very poor peoples and affluent society. Because affluent society, there is a trend to go outside, Singapore, Malaysia, and India. They fly with dengue fever, severe, and they die. And unfortunately, the poor people who use a non-steroidal anti-inflammatory like diclofenac for the fever, a lot of them die. So this is the fatality rate is in poor people and affluent people. So still dengue is a panic in our country. Dengue is a panic over the most people.
Do you think your patients know that there is more than one type of the dengue virus in your region, and that they can be infected with dengue more than once if exposed to a different dengue serotype?
Yeah, they know. Once they have dengue, and the second time if they have dengue, there are maybe more serious problems. They know. Yeah.
Do you think more education is needed to increase awareness of dengue in the community?
Yes, it's one thing. Dr. Hussain told before there was a lot of casualties, including doctors. But after we have set the national guideline, so the situation is improved. But case is a lot. These are people are suffering from dengue a lot. So awareness is there, and people is thinking this is a problem, big health problem.
And in fact, you see, there are lots of works in Bangladesh on dengue now. So we have got the WHO guidelines. Based on that, we have got national guideline, and in our hospital, in our department, we have got our own guideline to manage the dengue cases. So now awareness among physicians has increased a lot. At the same time, dengue people in Bangladesh, they know about it, and they are quite conscious about the disease.
What do you think is the reason for the observed increase in the number of dengue cases each year?
Well, dengue, definitely it was there. If I remember back, as I heard from my teachers, there was Dhaka fever, there was even case reports back in 1964, that was diagnosed as Dhaka fever. But perhaps those were the cases of dengue. But at the time, dengue was not so common. But as Dr. Mahmud said, after 90s, especially after the year 2000, definitely number of cases are also has increased, and at the same time, the recognition of the cases. So, for example, now in our country, we can have in our hospital, we can diagnose the case in just 24 hours after the febrile illness, whereas before it was serological test that used to take about a week's time until the child has fever for 5-7 days. You don't confirm the case. But now, even after 24 hours, we can confirm the case.
I want to supplement. Actually, after first outbreak, the cases are increasing. Though fatalities are less, but cases are increasing. After a lot of awareness program and mass media, electronics media, newsprint media, we are creating awareness. But in spite of that, I don't know, maybe the Aedes mosquito is increasingly more and more. This is confined in urban area, not in rural area. Actually, this very urban areas are affected more.
That's true. Yeah, I know. These Aedes mosquito cases are mostly in the urban areas, especially,
Dhaka and Chittagong,
in
big
Dhaka,
cities.
Chittagong, when there is intermittent rains, in our country, sometimes June to September, that is taken as the season for dengue. And
Rainy season, sir.
Rainy season, and especially when there's intermittent rains, some water is somewhere collected and, breeding of Aedes mosquito increases.
This is, I think, improper urbanization and people's habits are mainly responsible for this. There is pockets of water collection areas. This is increasing somehow. Construction is going on, renovation is going on. This is the responsible.
That's right.
Do you think we currently have sufficient measures in place to control the spread of dengue?
That's effective to some, but just with vector control, I think it's not possible to control the disease perfectly.
Actually, Aedes mosquito bite in evening and early morning. So in night, midnight, we use this mosquito net. Especially in our countries, in rural and hilly areas, for the control of mosquito, for malaria, we are using chemicalized these mosquito nets. But in evening, we are not using this. So vector control is really tough in our country. It's improper urbanization, huge construction, huge renovations. So we have to improve, but still we cannot achieve that goal.
Do you think the seriousness of dengue is clearly understood by your patients?
Yes, people have the experience. As I said, the fatality that in the year 2000, and this now our media, electronic and print media, very good in Bangladesh nowadays. So people, whatever happens, people come to know about that. And so, as I said, once they know, they think that this might be a case of dengue. Definitely, they don't. They, often, the dengue is 99% is mild cases, often asymptomatic. But the serious ones, they need admission in hospital. But for dengue, if parents know that the child has dengue, they agree to admit the child, or at least for the observation, so they know about the seriousness of the disease.
Yeah, actually, it costs this hospital stay, cost of medicine, cost of hospital stay, and this work loss. Everything is a big burden for a family and for the society, for relatives and patient himself also. I think nowadays it's clear to them, because media and people are becoming literate. Media is doing this. Actually, traditionally we are giving this not to this gather pockets of water around the house and use mosquito net, use propellant, use this. These are the advices. Actually, we are giving very traditional advice because we don't have vaccine.
No, at the same time, we also when you get a patient with dengue, we definitely advise the parents that the child should be protected, so that no mosquito bites that child. Because if mosquito bites the child, then that mosquito will be infected, and that mosquito will be spreading the dengue to other healthy persons. So those health education, yes, actually, this dengue, our Director of Health, they're taking lots of measures to disseminate this sort of health education about dengue.
Okay, it's a very good news and it's a breakthrough in management of this infectious disease. Sanofi Pastures is ahead and they are doing phase 3 trial and they are implementing this vaccine in 4 or 5 countries, so I hear. And we are hopeful. It will help us a lot in controlling this devastating disease, and it's very cost effective. And like Professor Hussain, I want to mention that ultimately it will be in country like Bangladesh, where dengue is very prevalent pandemic. We have to introduce this vaccine, incorporate this vaccine in our national health program.
Based on the clinical data, what impact do you think the Sanofi Pasteur candidate dengue vaccine will have in regions where dengue is epidemic?
Okay, one thing should be considered in countries like India, Bangladesh and third world developing countries, the cost should be considered. There should be considered price. If it will be considered price and doctors, pediatricians and health workers and public health experts, if they suggest, the people will take it. And if government come forward, it will incorporate in their EPI program. This will impact a lot in controlling this devastating disease.
Yeah, I think in our country, this vaccination EPI is a very successful program in Bangladesh, and if this effective dengue vaccine is in the market, definitely, people will accept it. But what I'm saying is to be, more useful for the common people. There should be, the pricing should be within the reach of these people. These are, awareness has increased a lot. So that's one thing. But at the same time, as I feel about the infectious disease, I talk to my patients, my students, that this is one intervention that immunization has made, so tremendous changes. Our, going to papers, some 100 years back, even in UK, the mortality was 200 per 1,000 live births, and now it's something like 6 per 1,000 live births. So, and this has been for the most, aspect has been achieved because of the immunization program, immunization communicable disease. And I think dengue, if not that way so, fatal, but definitely it's widespread. And as we are talking about the loss of, working hours, financial loss, suffering, and it's a very high time that we should have an effective vaccine for dengue.
From a clinician's perspective, in your opinion, what are the key considerations for implementing a successful vaccination program into a clinic or practice?
First thing, the information should be ventilated in proper way. We have to give information to the health professionals, doctors, health workers, media, and through media it should be ventilated to mass people. The impact of this vaccine, what will the impact of this vaccine, and if the doctors, health workers, and advice, and the general people become aware, I think it will be a very, very successful program.
And in fact, in Bangladesh, Bangladesh Pediatric Association, you see, this is the central organization of the pediatricians of Bangladesh. Actually, there is a committee, subcommittee for the MDG and Immunization Committee. I'm a member of that. In fact, we have finalized up-to-date, vaccination schedule, and we definitely take into consideration the importance of different vaccines, and definitely if dengue vaccine also available, we'll have due consideration for that. And if we designate to our all pediatrician colleagues, and they're working throughout the country, and the message goes to every nook and corner of the country quite quickly.
One thing should be added. He's the central. He's in central policy making of Bangladesh Pediatric Association. He's working in Dhaka. I am also General Secretary of Bangladesh Pediatric Association, Chittagong chapter. So we have two EPI schedule. One is EPI schedule by the government, and another vaccination schedule for Bangladesh Pediatric Association. So we will try, after having this information from this today's discussion, we will try, if it will implement, it's come in our country, we will try to incorporate this schedule in Bangladesh Pediatric Association.
Yes.
This vaccination.
It has not been included because vaccine so far is not available.
Yes.
But we made a recommendation, like American Academy of Pediatrics. They have got every 6 months they have a new recommendation for the
Update
vaccination policy in the country. Like that, we are also trying to do that. Definitely, dengue will have due consideration. Yeah.
Are there any specific considerations for implementing an adolescent and adult vaccination program?
Actually, though this is not confined to pediatrics only, but in country, you might know Professor Amar Khan, who is the national professor. He is the chief of immunization in Bangladesh. So, whatever vaccine comes in the country, the committee headed by Professor Amar Khan, they decide. So, even if this vaccine, as of now, from something 9 years to 40 or 60 years, definitely for all age groups, this government decision will be coming through the same, experts.
What type of resources do you think would be most useful to help healthcare professionals implement new vaccination programs and deal with issues that may arise?
Information is the answer. Information is the answer. They have to inform. You have to ventilate. You have to make seminar with pediatricians, top pediatricians like this. Then midwifery pediatricians. Then what about the general practitioners, health workers, community workers? Ultimately, when they will know the impact of this disease, they will be convinced and ultimately successful. So one thing should be added that there are some barriers. Actually, before starting vaccination in our country, there were taboos, superstitions. The vaccine may harm. So nowadays this is not a big problem. Cost is one problem. Number two is 9 years. In our country, traditionally we believe that small childs are candidate for vaccination at the age of 9 years. Is actually, so we have to make awareness. It will be no problem in future. Everybody is aware, doctors, pediatricians, health workers. What is the benefit of this? It will be, ultimately this will be successful.
In terms of introducing a new vaccine in your country, is cold chain capacity a challenge?
In our country, this is important that for vaccination, cold chain is very important, and that's why not all physicians or general practitioners don't give vaccines. Vaccines are given in appropriate centers where they have proper cold chain maintenance. So, patients are referred to those centers and the vaccines are given in those centers. In my center in Apollo, say we give at least vaccines to 200 children every day. 200, quite good number.
Situation improved actually. Situation improved. Before 2 to 3 years back, there was huge this power failure, everything. But situation is, and the hospitals, the individual doctors who used to vaccinate the people, they have some backup support, generator and other support. So nowadays, this is not a big problem in Bangladesh.
Are you familiar with conversion disorder, somatic symptom disorder following vaccination? Do you think this could be an issue with the introduction of a dengue vaccine?
Well, no, in our country, there were people that, with something like that, not so serious about that. But no, I don't think there are anti-vaccine groups in Bangladesh, like as we hear in the paper in some countries, there are really serious people against vaccine. No, I think we don't have that, serious group of people. But what I feel in Bangladesh, this vaccination, as I said, is a really successful program. People very, very much aware of, and especially now in country, Bangladesh, vaccination is given on 10, diseases. Government is providing free of cost. Of course, government is, with the help of Gavi, arranging all these vaccines. Yeah. So, if dengue vaccine is available, I think, that will be well accepted.
Okay, one thing, communications in our country is not so developed. There are a lot of areas where hard to reach. In spite of that, our first dose of this pentavalent coverage is 93%.
Very high.
And at 9 months, measles is around 87 or 90%. So it's big. So there are some groups, but they are not now active. So it will not be a problem.
If a dengue vaccine was available in your country, would you recommend it to your patients in accordance with its prescribing information?
Yes, of course.
Of course, and in fact,
because we are waiting for this vaccine.
Some 7-8 years back, actually, I attend this ICID meetings quite some time, and I think around 2010, we were told that the vaccine might be in the market 2016, and we're very glad that already it has been launched in 4 or 5 countries in the world.